Muhammad.
So it is very important for the Christian missionary to be trained on listening, point out the problem of the person who received trauma. The harmed person may see the danger in a different way. Therefore, the missionary should take in consideration the social factors, relational response that may help in building a relationship with a wounded person and to respond positively towards them. Some of these factors are development stage, second, family history or prior experiences, and three, personality types. So if that person is an extrovert or introvert, most introverts don't talk, are not really good in explaining and expressing their feelings. Some people have family history, like for example, their parents were like alcoholic or drug addicts, or they've been abusive to them or something like that. This is a big factor on how people behave sometimes. The development stage, whether they are teenagers or adults or they are children. So all these factors really help in identifying the problem of the person who is talking. Social factors may have an effect on the relationship in a different way. It's normal that the disaster may cause an extreme reaction. From religious perspective, the disaster is considered an abuse against good values and traditions. Most inflicted people ask, "Why did God do this?" or "Why am I hungry?" and others are living in a prosperous life. And where is God in all this? In this case, the Christian missionaries must pay attention to the symptoms of the trauma and try to make it easy when interfering. The best time to intervene is right after such a disaster happens. And as you see in this video, these people actually are interfering right after the disaster happens and try to help these people by giving them food, money, try to rebuild their homes and give them the the comfort that they need. So when someone is faced with a trauma, something just shockingly happened to him, like an accident in the car, or his house got destroyed, or for example, somebody died in his family, or something like that, like sudden death or something like this. What are the symptoms of the chronic stress? Of course, there are different symptoms. They have the physical, the cognitive symptoms, and the emotional and the behavioral. Let me read them quick for you. The cognitive symptoms is memory problems, inability to concentrate, poor judgment, negativity, anxious or racing thoughts, worrying too much, and so on. The emotional symptoms are depressed moods, anxiety, agitation, moodiness, irritability, anger, feeling overwhelmed, and loneliness. We have the physical symptoms such as aches and pains, diarrhea or constipation, nausea or dizziness, chest pain, frequent illness. And some of the behavioral symptoms are over or under eating, over or under sleeping, isolation, neglecting responsibilities, self medicating, nervous habits, and so on. So, for a Christian missionary, when he is faced by someone who has a trauma, it's very important to have what it's called emotional intelligence. To have an emotional intelligence is very much to also have some self awareness of what is going on around you. So you'd know what are you feeling at this particular moment and how to deal with it, and also how other people are feeling about you or about the situation that they're in, and try to help them. Not also that, but also to have a self management, self control, transparency, adaptivity, achievement, drive. All that comes with practice and training. Also for social awareness, as I said before, to have empathy and to help other and to have awareness and to have some kind of service for others to help them to get better. Also relationship management like inspirational leadership, developing others, influence, change, catalyst, conflict management, building bonds and teamwork and collaboration.